Good day, Sir Inandan and Sir Amores. I am Brion Heart A from BSN 1D, and today I will perform complete beta. So now I am here with my patient, and I will explain to him what I am going to do and the reason why I am doing it. So, good day po, sir. I am your student nurse for today, and I will perform complete bed bath to you. Is that okay po?
Okay.
Okay, so I will perform complete bed bath po so that we can avoid any microorganisms that may cause diseases, and we have to make sure that you are always clean. Is that okay po?
Okay.
Okay, so now that I am done explaining to the patient what I am going to do, I will now check the comfortability of the patient. So, are you okay too, sir?
Okay.
Okay, so now that I am done checking the comfortability, we have to offer the patient some bed pad and some tissue so that he will be comfortable throughout the process or throughout the bed bath. Okay, so let's assume that I am done offering the patient some bed pad. I will now perform hand hygiene. So, I will perform hand hygiene to reduce the spread of microorganisms. And we have to put some gloves. So, we have to make sure that the patient is not allergic to latex. Okay, so now that I am done putting my gloves on, I have to check the bed of the patient if it is locked, and as well as the side rails. So I am doing this so that we can prevent any movement of the bed while we are doing the bed bath. And we have to put the patient near to us so that we can reach the patient more easily, and we can check the patient's condition more easily. We can prevent also some back pains that we may occur. So now that I am done with that, I am going to put the bath towel on the top of our patient and then remove the top sheet. So I will cover the patient with bath towel. So, sir, pahawak ako ng ano. So, the bath towel prevents or helps the patient's warmth and prevents exposure. So now I will put the top sheet to our non-debug. So are you comfortable po, sir?
Okay.
Okay. So now po, I will remove the patient's gown. Okay, so sir, let's remove the patient's gown po. Okay. And then put it on the laundry pad. Okay, so now that we are done doing that, we are going to put some bath towel on the patient's head and on the patient's chest. So now, okay, so I will put towel to the patient's head so it is easier for me to wash the ears and the neck of the patient, because it can prevent the linens to get wet. So, sir? And then on the chest, so that we can prevent exposure of the patient's chest. So, sir? So, are you comfortable po, sir?
Okay.
Okay. So, now that I am done with that, I am going to wash the face of the patient now. So, I am going to wash the eyes of the patient first. So, I am going to check if the patient is wearing contact lenses or to prevent him from any injury in the eyes. So, are you wearing contact lens po, sir?
No?
Okay. So, I am going to wash the patient now. So, this is my bath towel. And then, one for the water, and then one for the soap. So, we have to wash the patient's eye first with plain water because soap can irritate the eyes. So, we have to maintain the hand towel. Okay. So now po sir, I am going to wash your eyes na po. So put it there. Okay. So once that we are done with that, we are going to dry the eyes of the patient. So I'm going to use this hand towel, and then we have to mighten it. Okay, so now that I am done washing the eyes of the patient, I am going now to wash his forehead as well as his cheeks and then his neck. So, sir, do you want to put soap on your face? No. Okay, so the soap in the face of the patient can cause dryness, so it is better to just use plain water. Okay, so now I am going to wash the face of the patient. As well as his ears. Okay, now that we are done with that, we are going to dry the face of the patient. So are you comfortable po, sir?
Okay.
Yes. Okay. So now that I am done washing the face of the patient, we can now move to the chest area of the patient. So in this, we have to use the soap and then the water and then dry it. So this is the soap. Okay, but first we have to put this here on the chest part here. Okay. So now proceed to this. Okay, so of course we also have to mighten it. Okay. So we have to wipe the patient. Okay, so now that we are done with the soap, I am going to use the plain water. Okay. So, by this, we can reduce the spread of microorganisms that are on the skin of the patient. Okay. And then after that, we have to dry it. Okay, now that we are done with the chest part of the patient, I am going to now proceed to the arms of the patient. So in the arms of the patient, I am going to remove now the towel on the head's part. Okay. And then I will put it lengthwise on the arm part. So by this, we can prevent the linens to get wet. Okay. So, sir, okay. Okay, so there you go. So now we are going to wash the arms of the patient. So we always have to put or to wash the farthest arms first before the near. Okay, so from the arms, to the fingers, and then now we have to put the patient's hands up for the axilla. after that, we have to put in water. So we have to wash it properly. Make sure that all the soap is gone. Okay? And then after that, we have to dry it. Okay. So now that we are done with the farthest arm, we are going to wash the nearest arm. Okay, so we have to remove this and then put it on the other side. So by this, it can prevent the linens to get wet. And then just do the same process. So we have to scrub the patient gently so that it cannot cause any irritation and any injury to the patient's skin. And then now we are going to dry it. So now that we are done with the arms of the patient, we are going to soak his fingers with another base. Sir, put po muna ako na. So we have to scrub it up and then soak it for about a minute. So we have to check the fingernails of the patient if there are any soiled nails. Okay. Then we have to dry it up. And then do it on the other arm. Okay, kabilang kamay naman po. Sige, sir, pababa po. Sige. Ang po masyadong yan. Ang bibigit. And now I am going to dry it. So now that we are done with the fingernails of our patient, I'm going to now move into his abdomen. So, sir. So now I am going to wash the patient's abdomen and then scrub it side by side. So as always, we have to scrub the patient gently so that it will not cause any irritation to his or her skin. Okay, and then dry it. Okay, so now that we are done with that, I am going to wash now the back of my patient. So I'm going to put him on a side lying position. So sir, can you do that? And then wash his back. Okay, so we can go to the anus or to the buttocks of our patient and continue the wash. Okay, so now that we are done with the back, and let's assume that I am also done with the buttocks of the patient, I'm going now to turn him on the position that he is in earlier. So, sir? Okay, now that we are done with the upper extremities, we can now remove the towel and then put the gown to our patient. So before we put the patient's gown, we can ask the patient if he or she wants to do deodorant or do lotion. So sir, do you want lotion on your skin po?
No.
Deodorant po.
Okay.
Okay, so I have here deodorant. And then we can ask the patient if he or she wants to do it himself or wants us to do it for him. So they want to do it for him.
You can do it.
We can do it. Okay, next. Okay. So now that we are done putting the deodorant to our patient, we can now put the gown back to our patient. So of course, it is a new gown. Okay, so natin natin ito, sir. So now that we are done with the upper extremities of the patient, I am going now to the lower extremities of the patient. So first is his farthest legs. So here. And then now we are going to wash it from the ankle to the knees and knees to the thighs. Okay. We always have to maintain the bath towel so that it can be more easier to us. So from his ankles up to his knees and then knees to the thighs. And then now we can do the water. So we always have to scrub it gently and check if the patient is comfortable. So sir, are you comfortable?
Okay.
And then after that, we can dry it up. So in this, if you think the water is already soaked or it's already too cold for the patient, we can change the water. But in my case, the patient is okay with the temperature. Okay, and then after that, we can put the soap on the foot of the patient. Here, first we have to put this so that the linens don't get wet. Okay, ano po akong pa. Okay, so we have to wash the patient's foot. And then we have to scrub it. Check if the patient's nails have any soiled nails, and then we have to remove them. Okay. Okay. And then we have to dry it out. So now that we are done with the farthest leg, we can go now to the nearest leg of the patient. Okay, so let's remove this. Then close it and then on the nearest leg. So we just have to do the same process that we did on the farthest leg. So that's going to pass it. Okay, and then we have to do the soap first. Okay, so it is better to do just one stroke or one-way stroke on the patient's legs, so that it can reduce the spreading of microorganisms. Okay, and then now we are going to soak the other foot of the patient. Sir, ano po ulit? Okay, so most of the time this is soaked for about 10 minutes, but let's just assume that I soaked it for 10 minutes. Okay. And then let's dry it. Okay, now that we are done with the nearest leg, we can now cover it up so that it will be comfortable for the patient's privacy. And then now that we are done with the upper extremities, the face and the lower extremities, as well as the buttocks and then the back of the patient, we can go now to the perineal or the genital area of our. So now we are going to proceed to the perineal care of the patient. So I am with my patient number 2, and then we will do the perineal care to her. So first, we have to ask the patient if the patient is okay with her position. So are you okay with your position too, ma'am? Yes. Yes. Okay. So now we are going to put a bath towel under here so that it can prevent the linen to get wet. And then now, we are going to put a basin. So now, I am am going to proceed to the cleaning of the genital area of my patient. So now I am going to use my forceps, and then here is my cotton balls. So I am going to wash first from the clit down to the anus of the patient, and then discard it. Then now to the minora, and then discard it. To the other minora, discard it. And then to the majora, discard it. Other majora. And then to the outside part. Okay, now that we are done with the cotton balls with the betadine, we are going to use cotton balls with a feminine wash. So from the clitoris again, up to the anus, discard it. And then minora. Then another minora. And then the minora. Another minora, and then the sides of the vagina. Okay, now that we are done cleaning the perineal area, we are going to put a water to the perineal area or the genital area of the patient. So now we have to rinse it slowly, so that we can make sure that the water will not go to our urine. Okay, now that I am done rinsing the genital area of the patient, I'm going to check if the patient is comfortable. Now, are you comfortable? Yes. Okay, so now I am going to dry the perineal area of the patient. So now we can use towel. Okay, so now we are done with the perineal area of the patient, and then we are going to make her comfortable. Now we are going to put now the top sheet to our patient. So going to put a new top sheet to our patient. May I ask you po ma'am to hawak po natin ito? Okay, and then we are going to remove the bath towel under the top sheet. Okay, and then put the used bath towel on the hamper or on the laundry bag. And then now, we can check if the patient is comfortable with his or her position. So, are you comfortable po ma'am? Yes, okay. And then we can remove now the PPE that we are using, the gloves. And then perform hand hygiene. And now we are going to thank the patient for her time. So, ma'am, thank you po for your time. And I hope that you are comfortable throughout the process of the bed bath. So, you're okay po, ma'am? Okay. So, now we are done with the complete bed bath. Thank you for watching.